Good morning. I think we can say that for another 50 minutes or so, right? Welcome to another session with Bryn Barrett with Dr. Bills. But I'm we're going to talk about first aid for caregivers and when to call 911 and a bunch of other stuff kind of thrown in. And then we'll have a little fun at the end where we kind of give a couple scenarios and then we'll ask for your help to kind of figure out what to do. All right. I want to thank you for inviting me. It's an honor to be here. My name is Dr. Stephen Bills. I was born, raised, educated, and I've worked here my entire life. So you might say I'm kind of a homeboy. I am residency trained in emergency medicine, and I have worked my whole life in Northwest Ohio. I worked in emergency medicine until about 2016. And at that time I left and I've done some occupational medicine. I've done some urgent care. In fact, I was just recently working down the street at Health and Health Center. Created, own, and run TeleMeMD, which is a direct concierge medical service where I take care of people in their homes. I don't have an office per se, but I go out and I do kind of the Doc Brown thing. I go out and actually make house calls like the good old days. And we actually use telehealth and things like that to take care of people. I will just point out my lovely family here, my wife of 30 plus years, Kendra, her age is not to be mentioned. My son here is now, this is him over, my son is on the far right there, and my daughter, and we're very proud of them. We've got a couple of fur babies there as well. Next slide. So, what is the importance of first aid for seniors? I mean, why is it important? Well, as we get older, we have increasing problems with health issues, correct? Due to our age and wear and tear, higher likelihood of chronic conditions. We have slower recovery times when we do get injured. We have increased risk of falls and injury. We're going to talk a little bit more about that as we go. There's a higher likelihood of being on certain medications for said chronic conditions, which may complicate injuries, and we'll see that as we go. And unfortunately, as we get older, sometimes we lose our transportation. We lose the autonomy to get into a vehicle and go and seek medical care. And so access to medical care becomes an issue. So maybe you've got a mobility issue and it's hard for you to reach the phone. Maybe you have, maybe you've fallen, you can't get up. Have we ever heard that? All right. So there's some things we're going to talk about on how we can mitigate some of those things. Next slide. All right, so this is a busy slide. Here's some chronic health concerns for seniors, and these are kind of the major ones. Heart disease is the leading cause of death among older adults. Did you know that? Did you know that was the single thing that is the highest? There's lots of things that we can do for risk prevention, and hopefully we have already instituted that before we get to our upper ages. Cancer is the second leading cause of death. There's definitely an importance of staying in touch with your physician, doing the screening tests that we need to do along the way, and watching and waiting to make sure that we catch things early. Diabetes is one of those diseases that continues to grow in our population, and that complicates lots of things, and the medications that we use can also complicate things. Respiratory diseases, chronic obstructive pulmonary disease, pneumonias, stressing the importance of vaccinations. As we get older, we need to consider taking the pneumovax so we hopefully stop some of the bad players where respiratory illnesses are concerned. And then mental health. Mental health is dementia, Alzheimer's disease. That is certainly on the rise. I can't imagine that any of you don't have a friend or a family member that doesn't have those issues. I know I've certainly had it in my family. Depression and anxiety. Unfortunately, that's something that is commonly overlooked or underreported in the aging population. Isolation becomes an issue, a loss of a spouse, you're living alone, kids are out of town, friends are dying off, those kind of things. It really, especially around holiday time and springtime, can be a big problem. And so we need to be aware of those things. We need to be in touch with our physicians. Bone and joint health, osteoporosis. Anybody heard that term? You know, there are screening tests that we use for that. There's medications that we use for that. Diet, exercise, mobility really can help with some of those things, as is the next one, which is Mr. Arthritis, right? Anybody have a problem with that? All right. And then some of the medications that we're on, if we're on statins, that can cause all kinds of joint discomfort and things like that. And then sensory impairment. You know, maybe your eyes aren't as good as they used to be. Maybe your hearing isn't good as it used to be. Maybe your balance isn't as good as it used to be. Anybody want to jump on the new roller coaster ride at Cedar Point? Anybody? All right. So these are kind of some of the chronic things that we're going to talk about. Now, here's some common emergency kind of situations that we should pay attention to, and we're going to talk a little bit more about this as we go on. You know, we talked about heart disease being the #1 cause of death. So heart attacks, strokes, your respiratory issues. I almost thought we were going to have to get into something here because we had a small choking episode before the rest of you showed up. I won't point out who it was, but I was standing by and prepared to do a Heimlich maneuver. All right. So hypothermia and heat related problems. You know, as we get older, we're more sensitive, and the medications that we're on make us more sensitive to heat. You know, back when we were younger, we'd run outside in shorts and a t-shirt when it was 20 below zero and think nothing of it. But as we get older, we lose some of those abilities. So that's a big problem. Dehydration is a huge issue as we get older. And why is that? Well, because as we get older, we have problems with our bladder, right? I'm not going to ask for a show of hands, but I know I have family members who say, well, I don't take my water pill when I go to church because I don't want to pick it up, or I don't drink before I go out to eat because then, you know, and so we chronically run around in a state of dehydration, which is not good for us. All right, falls and fractures, and this one we're gonna get into a little bit more closely because it's a big issue. Some sobering statistics about falls. All right, leading cause of injury for adults over 65. Not car accidents, not, you know, something that happens in Chicago, but falls. 14 million falls a year. 1 in 4 adults report falling every year. And it's the leading cause of injury-related deaths in adults 65 and older. And the unfortunate part, next slide, is that death due to falls, the mortality associated with falls goes up as we get older. Now, I was taught in medical school, and they didn't tie a particular age to that, but breaking a hip in somebody who's 80 years old has a 50% mortality associated with it. Not from the injury itself per se, but from the complications of that. You know, heart attacks, not surviving the surgery, respiratory problems, those kind of things. There's just a whole host of cascades of kind of like the dominoes and things that takes effect. And then we've got this fall cycle thing, which is where you fall, you hurt, you fear of falling again, so you move less and less activity, which causes decreased muscle strength and balance, which in turn increases your risk of fall. How do we mitigate these things? What can we do so that we don't fall? Well, we're going to talk about those, but not yet. All right. Did you know that medications can have a significant effect on whether you fall or not? This was surprising even to me because I didn't realize that the #1 increased cause of falls in medications is antidepressants. So we talked a little bit just a moment ago about isolation and depression elderly folks, but antidepressants, antipsychotics, sleeping pills. Surprisingly, the painkillers, the ones that I would think would be the most likely thing to cause falls, is last on the list. But you can see a couple of those things here. All right, so next slide. Anybody heard this old American English proverb? An ounce of prevention is worth a pound of cure. Who said that? Benjamin Franklin. It's underneath that. Okay, before you show it, what year do you think he said it? Very close, 1775, apparently. And he said this after reading about how Philadelphia's fire department had done all these steps to help prevent fires and things like that. So he was quite impressed. What are your thoughts? There are preventative measures that we can do to help us prevent falls. So home safety modifications, grab bars, non-slip mats. Can you tell me the worst thing that you can have in your house as you get older? Throw rugs. How many of you have throw rugs in your home? Right, so do we. And the reason for that is either they slip or your shoe catches on them as you go past. Get rid of your throw rugs. I know they look pretty and they make the sound in the room come down, but get rid of your throw rug. Even the type of shoes that you wear can make a significant difference. I'm not even going to. All right. There are a lot of shoes out there that are marketed to older adults, walking shoes, etc. And I'm told that the kind where the tread on the shoe comes up over the toe, like on the very front part of the shoe, will increase your likelihood of tripping because it has grip and it catches on those things. So don't wear shoes that have that. Everybody's look. All right. Regular exercise. I can't stress this enough. You've got to be able to move. You've got to exercise. We're going to talk a little bit about more of that as we go here. Chronic disease management. So maybe you have high blood pressure. So maybe you have depression. So maybe you have problems with diabetes, those kind of things. The best we can do is to go with bad hearing, right? I thought you were saying you couldn't hear me. Okay, okay. There are things that we can do, right? You need to go to your doctor. We need to make sure that these are under control. And then there are emergency preparedness things like keeping a well-stocked first aid kit. We're going to talk a little bit about that here in just a minute. And then having emergency contacts and medical information readily available. Do not rely on the emergency room to have all your medical records. I can personally tell you that doesn't work. It's supposed to, but it doesn't. So, in years past, you used to put a label on your refrigerator door, and then you have your medical information in there. That is very helpful to EMS and emergency department situations. So make sure that's up to date, that you've got a list of your medications, your list of your medical problems, your medical contacts, because if you can't speak or there's no one there to speak for you, it's very difficult to get that information. So that's important. Next slide. Lifestyle and preventative measures. We're going to spend a little bit about that. So what's the best diet? Are there more than one? Are there like unbelievable amount of different diets that are out there that you're supposed to do? Anybody have one that they like, or anybody know of any? Mediterranean diet. Well, I'm glad you said that because that's supposed to be the best one for heart disease. And the Mediterranean diet emphasizes fruits, vegetables, whole grains, legumes, which are beans, nuts, olive oil, and lean proteins, especially fish. It stresses limited intake of red meats and processed food, and it's known for its heart health benefits, anti-inflammatory properties. That's real key. It's low glucose, so it's low fat, but the fats that are taken are good fats. It's anti-inflammatory, which helps with 1,000% of diseases. What about exercise? What's the best exercise?
Wait,
Swimming, weight training. Anybody else? Walking, all right. You have any runners in here? All right. Well, I would maintain that the diet or the exercise program that focuses on growing and maintaining muscle mass is the most important. So that's weight training and high intensity weight training in particular. It helps your metabolism. Higher muscle mass increases your metabolic rate, aiding in weight management. It enhances your physical strength, balance, and mobility, reducing the risks of falls and injury. It supports bone density. If you move it and you use it, the body will continue to hang on to the calcium, provided that you're providing it in your diet. So it improves your bone strength, lowers the risk of osteoporosis, Glucose regulation improves insulin sensitivity and glucose metabolism, reducing the risk of diabetes. It contributes to better cardiovascular health by aiding in blood pressure regulation and reducing cardiovascular disease risk. And it helps maintain independence and quality of life in older adults by preserving functional ability. So there's a term that we're going to just briefly mention. Have you heard the term lifestyle before? Or how about lifespan? All right. Lifespan is just basically how long we live, right? Well, there's an increased focus now on something called health span, which means in addition to living for a long time, health span is how long you live in a healthy manner that is functional. All right. So we want to preserve those things so that our lifestyle and our lifespan actually is more rewarding as we get older. All right, regular health screening aids in early detection and management of health issues, hopefully to prevent some of the severe complications. If you live your whole life with high blood pressure, it takes its toll on the body, and you're going to have problems with arteriosclerosis, heart disease, stroke, and blood pressure issues, for example. And then social engagement, right? We need social opportunities. It helps our mood, it helps with our mental health, etc. Next slide. So doing things like first aid training and things like that really talks about our support system. Not only should we be trained in first aid, but we should have those around us trained in first aid, because you never know when you're going to need it, right? Or be needed in another way. So caregivers do lots of different things. We have medical support, physical, emotional, and social support. You know, I can personally attest that there's a difference between a caregiver and a family member. Now, sometimes the family members do the caregiving, but there's always a conflict with that because caregivers are the ones actually taking care of the individual, where sometimes the children, the family want to remain in that role. So that can be an important distinction. Home safety, we talked a little bit about modifications. I would, if for those of you who are tech savvy, I would encourage you to go onto YouTube. It's VIP Therapy PT. It's a really good friend of mine, Dr. Brianna Barney. She's a a great lady, but it's called YouTube. It's online. It's like the biggest video platform. The one that you should write down to look up, it's called VIP Therapy PT. And she has lots of little snippet videos to kind of help explain, you know, if you're wheelchair bound, how do you transfer? How do you go from one place to another? How do you get in and out of a car if you have mobility issues? How does a support person help you with, say, a lift belt, a walking belt, and we're around to kind of help support people? How do you get upstairs? How do you get out of bed? She has all these really neat little snippets that are very valuable. So I would encourage you to use that. And then you know, medications. All too often, Medications have these big, fancy, horrendous names that we don't understand. I'll just tell you a quick story. I realized that we were in trouble when I walked into my mom's bathroom and she had all her medications in Dixie cups. And I mean stacks of Dixie cups. There's this, gobs of one in each one, and she just going in each morning and throw them back. And I'm like, what do you do? Oh, that's my morning medicine. That's my afternoon medicine. So, well, what's in it? Well, my medicine. I go, yeah, but what is this pill? Oh. We got to make sure that we're taking medication properly. We may need to ask for help with some of those kind of things. Next slide. Emergency preparedness. How about a first aid kit? Does anybody have a first aid kit at home? Right. Should we have a first aid kit at home? Yes, we should. And should we pilfer out of it and not replace it? No. There's some essential items that we need, and on the next slide or next few slides here, we're going to be talking about that. Again, just to reiterate, emergency contacts and information. Make sure that you have that up to date. I can't tell you the number of patients that I've seen in the emergency room. I'm like, well, what medications do you take? And they pull out their wallet or they dig around in their purse and they come up with this tiny piece of paper and they start unfolding it, and you kind of trying to make sense out of it, especially in a man's wallet. Everything sort of disintegrates in there and the ink smears. Make sure it's legible, make sure it's up to date. Okay. And then important phone people. So call this person, contact, here's my doctor. That information is really important. Talk a little about safety modifications. Next slide. So training and education. Where do you get trained? Well, I'm sure there's some local areas. I'm just going to talk briefly about the Red Cross. Is it expensive? Anybody have any idea what it takes or what it costs to do with that?
Is it free?
In some places it is. I'm sure that hospitals and some, I don't know if you can do that here, but the online portion for first aid, CPR in adults is $37. And you take that online, that portion of the course is done online. Then there's a skills testing that has to be done in person. And the local Red Cross charges $42 for that. So it's not horribly expensive. It's far more interesting to me. So but it is important that we get trained, in CPR, in first aid, and we stay updated on that. Next slide, please. All right, basic first aid techniques. So, and one of the things that I think that you'll learn a little bit more in our next session will be on wounds and wound management, simple wound management. Most wounds do well with clean water, soap and water, and then a bandage, and then seek medical attention. Treating burns. What about burns? Who here thinks that you should put butter on a burn? All right, well, that's a real common wives' tale. Don't put butter on a burn. But again, cool water, avoid any really hot water, any really cold ice kind of stuff. Butter, oil, leave those kind of things out. Managing falls, we need to assess for injury, make sure that we're thinking about broken bones, broken necks, bleeding in the brain, those kind of things with falls. Tread gently when getting them up, and seek medical attention when you need to. I think the other portion of this is that we frequently, I know myself included, I'll handle it myself. I'm fine. I'll take care of it myself. And most of the time with it, let's be honest. But there are times when we really shouldn't.
Well, especially when you hit your head, right?
Yeah.
Oh, yeah.
Yes.
Yes. And I've got a perfect case for this coming up at the end of the series here. As we get older, our brains shrink. And our brains get its blood supply from around the skull. The skull does not shrink. So there are these called bridging arteries and bridging veins that kind of go from the inside of the skull to the brain itself. So as we get older and we bang our head, the brain's got a lot more room to flop around. And that can be really problematic on those bridging veins and cause bleeds very easily. Especially if we're on certain medications like blood thinners that make us more prone to bleed, right? Respond to choking. All right. So when I walked in here earlier and there was a particular individual who had a choking episode, I was on standby mode, right? If they're able to cough, they're able to clear, leave them alone, especially if they're able to talk. However, if they're not and they're not doing well, what is the universal choking sign? Anybody? Like this? Yeah, everybody knows that, right? And then we perform the Heimlich maneuver, right? I'm certainly glad that that particular doctor won out over his predecessor or his competing doctor called the Dr. Heimlich maneuver, which would not be as nice to do. That was a joke. Come on. Well, okay, all right. Let's get signs of stroke. Everybody heard about this FAST method? It stands F stands for face drooping, A stands for arm weakness, S stands for speech difficulty, and T is it's time to call 911. All right. Just something to keep in mind if you see somebody who's struggling with any of those issues, call 911 because just like a heart attack, we've got some really interesting ways of dealing with strokes now. Like we mentioned earlier, we can reverse it. And then managing heart attacks, chest pain, shortness of breath, please call 911. All right, next slide. Talk a little bit. I'm not going to go through each and every one of these. I would just encourage you to go online. If you go to the Red Cross website and type in your question section, first aid kit essentials, it will go through and show you something like this. This is a pretty simple one. I think there's a couple things in there that are very important. That little device up there, the breathing barrier, this day and age, mouth to mouth is not as, hygienically pleasant as it used to be. Not that it was ever pleasant, but this is a way of putting a bag. It's kind of a device that goes over the mouth so that you have to give mouth to mouth. You're not coming in direct contact with the individual. Gloves, obviously, some bandages and things like that. So go to the website for the web Red Cross. Keep it easy to access. Consider having more than one. Put one in your vehicle so that you've got one close by. Keep it updated and well stocked. I went to use one at a church one time, and it had been pilfered over the years, and the Band-Aid, it didn't even stick anymore, and it was just it's just worthless. Next slide. Situations requiring 911. These are pretty straightforward, but you'd be surprised. Difficulty breathing, chest pain, suspected heart attack, signs of stroke. Remember the FAST, face, arm. What's S? Speech, good. And T is time to call 911. Major falls and injuries, severe bleeding that doesn't stop, unconscious or unresponsiveness. There's a key one here, the last two here, changing mentation after a fall. So you might have someone who falls, hits their head, says they're fine, and you think everything's okay. But because of those bridging veins, there's a small bleed going on, and it takes a while for that bleed to start showing its effect. So be vigilant for someone who has hit their head, or even yourself. If you notice things are changing after you hit your head, that's a sign of an emergency. All right. First time seizures. All right. Somebody that has seizures all the time, maybe that's not a big deal, but first, somebody who does not normally have seizures, who suddenly has a seizure, that's an emergency. Next slide, first. Tips for effective emergency calls and situations. So, call early rather than late. Don't call somebody, meaning, well, I'm going to get a hold of so-and-so's daughter first, or I'm going to get a hold of the son, or I'm going to call the doctor first. When there's an emergency situation, call 911, because there's a lag time between when you call and the emergency help arrives. All right, so do that, stay calm, speak clearly, provide as exact a location as you possibly can and let them know the nature of the emergency. Technology is kind of fun. You know, in the old days, we didn't have cell phones, you just picked up a phone and they had the ability to know exactly where that phone was. It's a little different with the cell phones, but they still prefer landlines. Make sure that the phones that you have are easy to use. Big letters, bright numbers, whatever it takes. Make sure that once EMS has been called, that you've got the front door open. If it's nighttime, turn the lights on. Make sure that the dogs are put away. You just make sort of streamline things so that they can get in and do what they need to do, and then open the door. Next slide. How about these little devices? These are the help me, I'm falling and can't get up buttons. All right. Seniors should keep a phone or emergency communication device within reach at all times, including the shower. So I made sure that my wife's grandmother has one of these. She refuses to wear it at all times. And so she was in the bathtub, seated on her chair, and she went to get up, and things didn't go quite right. She went over backwards in the tub. She's 90, 93, 94. So she's in the tub on her back. Her phone is sitting on the counter where she can't reach it. Can't get up. And she didn't have her push button, which would have saved everything. Luckily, my mother-in-law was coming over. And so she only stayed in that position for about a half hour. But what if my mother-in-law hadn't? You know? Make sure that you have one of these devices. It could be absolutely life-changing. All right. Next slide. So I've talked a little bit about in a general sort of way, but let's apply some of these. I find these are more fun and have much more interaction. I promise no more bad jokes. So I will tell you ahead of time, not that the picture is correct, but this was an actual patient of mine. This scenario is based on that. So an elderly lady is on her way into Walmart. She's got her walker, and as she comes in, she goes across one of those throw rugs. Trips, falls, and hits her head. You lose consciousness. She's got a small bump on her head, a little abrasion. She's complaining of a headache, and she insists that she's fine. What should we do? Do we pick her up and put her on one of those electric carts and send her on her way to go do her shopping?
Well, call 911.
Call 911. Why?
Headache and pain.
Headache and pain. And what you don't see here is that this lady has a history of atrial fibrillation and is on Coumadin. Coumadin is a blood thinner, so that we don't form blood clots in the heart or fibrillation and cause strokes, but it predisposes us to bruising, easy bleeding, and in this case, she had a head bleed, and we had to transfer from Defiance, where I was working, to the hospital. All right. Next case.
Oh,
How about these little lovelies? All right. 75-year-old male is bitten by the neighbor's cat, so it's not a stray cat. Sounds like a band, doesn't it? Gets bit on his right hand. It's his thumb. There's 2 puncture wounds on both sides from the high teeth of the cat. The cat is up to date on its rabies shot, so we don't have to worry about rabies. And there's minimal bleeding. What should we do?
Suck it up.
Literally, like put it in the mouth. That's a no-no. Wash it with soap and water. Does it need anything else? Antiseptic bedding. All right. Anything else?
You call the doctor and ask him.
Yes. Is it necessarily an emergency? Probably not, unless there's some involvement. And where you can't move your thumb. What if I told you that 80% of cat bites get infected?
mhm.
80% of cat bites get infected with an organism called Pasteurella multocida. And those, in my opinion, all people with cat bites should be given prophylactic medication, which is typically augmentin, amoxicillin, and glycolic acid, to help prevent infection. What's the other thing you worry about with cats?
Cat scratch fever.
There you go. Cat scratch fever, which is actually a completely different organism called Bartonella henselae. Although when I went to school, it was Roche-Lamea, so they keep changing the names. That's why medicine, and it has its own language, doesn't it? It's difficult to follow all these different things. But it's definitely, this person is definitely a good candidate for washing your hands with warm soapy water, calling the doctor, getting started on some antibiotics. So fun first aid, right? Next case. All right. This is an 89-year-old female who suffers from mild dementia. Normally, this lady is a little confused, doesn't necessarily know what day it is or that, but she's happy, she's interactive, she's able to dress herself, feed herself, and get around and go to the bathroom by herself. But now on this particular day, some caregivers are noticing she seems more confused, she's sleeping more, she's more argumentative, and maybe a little belligerent. And they notice that she's going to the bathroom more frequently. No fever. What should we do?
She could have a UTI.
Yes. 10% of females well, of any age, but especially older folks, get urinary tract infections. And we see the first sign of that is usually a mentation problem. All right. As we get older, we lose some of those typical things that we get when we're younger. You know, the burning, the urgency, the frequency of urination. We sometimes still get those, but sometimes not. And then the only thing that you'll see is a mentation change. So is this an emergency? Could be. Yeah, that's a key point, and one of the reasons I put this in here. Why should we take care of this? And by take care of this, I mean we need to at least get the person checked out. We need to have a urine sample drawn. We need to understand if there's a bacterial infection that we need to get started on an antibiotic product. Why is that important?
Because it can get worse.
And specifically, as it gets worse, the infection leaves the bladder, it gets into the bloodstream, and the person becomes, as we say, septic. All right. Fever, and it seeds the infection through the rest of the body. All right. And people are ill. And I know lots of older folks that have a pain tolerance that I can't even imagine. All right. I had one patient, she ended up actually having a kidney stone, but had an infection on the kidney side of it. The infection got outside of the kidney and it spread to the bone of her spine. Okay. All right. So something that is, quote, simple urinary tract infection can become much worse in this worst case scenario. And the key thing is time. Right? And one of the things that I continue to rail about our medical system is, hey, mom's not feeling well, think she might have a urinary tract infection. Oh, no problem. We'll get you in next Thursday. Hello? We don't want to wait that long. So your points are very well taken. Yeah.
So, you know this, but she refuses to go. Get us
I do. Yeah, the question was, well, in this state, is this lady likely to want to go to her doctor in the first place, right? Is there anything that we can do? All right. The answer is yes. We can collect a urine sample by putting, we call it a hat. You know, there's a bucket with a lid or with a rim on it, and stick it on the toilet, and go in and they go to the bathroom and collect it, right? That's one way of doing it. Or we just say, hey, these are the symptoms, and the doctor sometimes will give an antibiotic as a presumptive diagnosis and see what happens. Or you can call somebody like me and I come out of the house, we'll test the urine right there, that gets so separate.
What about men? They get them as a.
Men do not get them as often. And that's just about an average. The urethra in males are usually longer than the urethra in females. And the distance between the outside and the bladder is longer. Now, all bets are off as soon as the male has what? Fully catheter? Or someone who self-casts themselves with a catheter because of large prostate. All right. So that's an excellent question. My dad became septic from self-cathing himself due to an enlarged prostate and prostate cancer, actually. He was in the urologist's office, and 2 days later, he was in the hospital with sepsis. And he had a significant drop in his mentation. He went from being able to be in assisted living to being in memory care just for that one extension problem. So. Men do get urinary tract infection. It's just less. All right, next slide. How about a burn? 69-year-old male burned his hand while lighting the charcoal grill. It's mostly on the back of his hand. It has some blisters. You see it's kind of wet there. It's weeping. It's very painful. No numbness. Does not completely go around the fingers, which is something we watch for. And he moves everything well. What do we do? That's one approach. Who wants to go grab a slab of butter?
No.
Thank you. We got that taken care of. All right.
Cold water, something cold.
Cold water, soap and water, cover it, usually with a wet dressing. Believe it or not, as long as it's not extensive, meaning it's not covering the whole hand, as long as it's not going all the way around, this would be considered a superficial second-degree burn. And you can treat that with some silver cream. You can treat it also with neosporin. And my son got on his little mini motorcycle that my wife is not very happy about in his shorts, which I wasn't very happy about, and burned himself on the inside of his leg on the hot exhaust pipe. Guess who was responsible for taking care of that? Because Mom was not happy. We took care of him with, and he had something like this as well. We took care of that with some neosporin, and we did pretty well. But this is probably something that could be taken care of at home if you know what you're doing. But the key point is that these do not necessarily, and these folks will back me up on this, they do not automatically lead to that. All right. Last scenario. This is an interesting one, and this is based on a similar story. 76-year-old male is in a wheelchair. His wife takes him out to the park for the day. He's not really been feeling well, but nothing specific. She's kind of sitting there watching him, and he suddenly slumps forward very suddenly and slips out of the wheelchair onto the ground. She runs over to him. He's unresponsive, won't wake up for 30 seconds, but then he wakes up right away, and he insists that he just fell asleep, slipped out of his chair, and just needs help getting back in the chair. And I'll be fine. All right. What do you think? This is not urgent care. This is 911. All right. What likely is happening with this guy is he's having a heart attack, and he just had a short bout of VTAC. He had an arrhythmia problem. And this happens pretty commonly. One of the treatments for that in CPR, you know, when it's a witness arrest, you thump them on the chest, right? I mean, you've heard about that, but it does work. And sometimes when they hit the floor, that's kind of self thump. It's enough to restart the heart. Sometimes not, but this is definitely an emergency situation. I would not recommend, you know, calling daughter or calling doctor. You call 911, take this guy in. All right, next slide. How about questions? There's no such thing as a bad question. Anybody have a question? Yes.
Okay, my husband's had several falls.
Yep.
November. He fell 3 times, 11 hours at home, so he went to emergency room, he was in the hospital 5 days in Woodhaven. Okay, at the end of January, going to Levis Theater, he fell on the ground bleeding, but it was his nose. Thank God he was always talking, so he went to Caregiver Hospital for 10 days. And then, BG Medical for 19 days. Point is history involves.
Mhm.
At home, he uses a walker, going out, transport wheelchair. So he said to me this morning, could you measure my head? I want to get a helmet. Dr. Barnes, his family doctor, said absolutely not. It will make your condition worse. So, he writes me notes because he doesn't hear well. So I wrote absolutely not. He also has mild dementia. I was concerned that he would say, why are you arguing with me, etc., but he didn't. So my question to you is, in your experience, as far as patients with falls, does anyone use helmets?
No. In short, although it seems like a great idea.
Right.
Put yourself into the mind of an emergency doctor for a moment. And think about the sports teams that have a head injury or a neck injury. When they come into the emergency room, that helmet now becomes an impediment. We have to specifically, sometimes even cut the helmet off or take it off in a specific way to gain access to what's going on. It sounds like a great idea. And we always talk about that. Well, I should just wrap you up in bubble wrap, I mean, it's just not practical. Nor and it could very much cause a problem from a rescue standpoint. If the helmet isn't fitting correctly, and I'm thinking of, a big fitted helmet. I suppose if you want to have them wear a bike helmet or something along those lines, it is a protection device that is not really addressing the bigger issue. And the bigger issue is the falls, right? And so that's a safety thing. Yeah. Any other questions? I didn't anticipate that one. Yeah.
So I've heard if I fall, I call 911 and all they do is pick me up. They don't transport me. Do I have to pay? You know that?
I believe if there is no transport, you do not have to pay in most things. There's the other side of this, and that is, having said that, and I don't want to cast aspersions on EMS, but if there is a benefit to not transferring the patient, I don't have to do the paperwork. I get back to the dispatch quicker, those kind of things. I've seen it happen where people are talked into signing out when they really shouldn't talk. Right? But in terms of your specific question, I think that if they're called but don't transport, that there's not a fee.
Yes. We received we call it EMS, and we received a $50 bill. But then, going to the same session that you were at last spring, and the EMS people spoke, and they said they would never send a collection agency after. So I just didn't pay it, see what's happening. You would get a bill for $50.
But it's not the same amount that you would get if they transported.
Oh, yeah. That's pretty fun.
And don't even talk about the bill for a transport by helicopter.
Oh, no.
All about that too. Other questions?
Who decides the helicopter decision?
Usually the emergency physician or the EMS if it's a scene call. If it meets certain criteria.
A lot of it's distance too, right?
It's distance, yeah. Well,
Sure.
it's distance, but it's also the level of care. So when I was on the helicopter, I mean, there were times where we were called to Flower Hospital to transport a heart patient from Flower Hospital to Toledo Hospital. Now, it's not that far, right? So you think about the time that it takes to call the team, start the helicopter, get the helicopter airborne from Toledo Express, fly all the way to Toledo or to Flower, shut the helicopter down, take the stuff out, go inside, and then reverse that whole process. From a time standpoint and a distance standpoint, I think that there can be a case made that it's faster to go by ground. What's different, at least when I was flying, is that the level of care, there was a physician on that helicopter. And so I'm taking a person who is critically ill, I'm turning them over to another physician, and that physician is then reporting the patient, rather than going from a situation that is relatively controlled with a physician and nurses, and then going to, say, just a paramedic. Or we drop down in terms of the level of care that's necessary. So those are tough calls. Not anymore. Not anymore.
Okay.
That changed.
Yes,
Would you please say something about the importance of knowing which antibiotics you can tolerate and which are verboten? My situation was a urinary tract infection, a prescription for antibiotic, which was way stronger than it needed to be. And it's now on my list, but and after the second pill, I had to call 911. I ended up in the hospital, and when they got, when my family physician saw me after discharge, he said, "Oh, I've never seen a kidney this close to rupturing."
well, I think that any medication, not just an antibiotic, needs to be chosen with specific reasons and for specific care. And obviously there's medications or indications. One antibiotic does not necessarily work in every part of the body under every situation. So there are several antibiotics that are indicated for urinary tract infections because of their properties, their concentrations, and things like that in the bladder. No, none of us would knowingly want to give anyone something that was going to hurt them. Problem is, we don't necessarily know that ahead of time. And the concept that this antibiotic is, a super antibiotic that covers, that is overkill to be used in this situation. Yeah, there are some things like that. You probably don't necessarily need an IV imipenem to treat a urinary tract infection, but for the most part, no one would prescribe something for you that was, quote, overkill if it wasn't indicated. I can't say that always happens because I'm human, just as we're all human, we make mistakes. I'm sorry that happened to you.
We used to hear a lot about MRSA. I mean, it was just like everywhere all the time. Lately, I haven't.
Oh, it's still very, very pleasant. Absolutely. We all have it. We all have it. I'll tell you right now that you all, right? The problem with MRSA is not that it exists. The problem is when it's given an opportunity to invade into areas where it should not be. That's where the problem is, because it's very difficult to treat, but it's ubiquitous, meaning that it's everywhere. Most of us handle it just fine because our skin is intact, or the good bacteria in our gut take care of those kind of things. But I know that I have it, that around it, and once in a while I'll get a boil or something that takes place, and I know that's my thing. But if you're healthy, you can usually take care of those things. Your immune system will take care of them. Yes.
I know as older people are supposed to get pneumonia shot.
Yes.
So it was in 2000. I remember it's been 43 at the time. I just did math. I got a pneumonia shot, or I got a flu shot. Ended up with a pneumonia shot at the same. They asked, "Do you want a picture?" And I went home and I had trouble breathing. I mean, I just felt tight, you know, and it didn't go away, I swear to you, thank God, see a doctor. And I ended up, had an exercise bike in the basement and I started doing that and, you know, and it helped. Or it was just time-wise, okay? I've never had one since then.
Right.
So it was 2000. Are there different pneumonia shots? Should I never get one?
There are, and sometimes it's an egg allergy, depending on how the stuff is big. I would always say in those situations, you should consult your doctor before you do it. That sounds like you could have had some kind of reaction to that. And let's be honest, you know,
Yeah, so never get a pneumonia.
I would never say never, but I would do so in direct consultation with your doctor and explain what your concerns are and the reaction that you had to it the first time. You may very well say it's not worth the risk.
Okay.
I think my time's up, folks.
Perfect, yes.
Thanks for having me.
Thank you.
Well, good afternoon. My name is Craig Smith. I am the program director at the Wound Healing Center over here at the Wood County Hospital.
And I am Melissa Corbett. I am a doctoral student for nursing practice. So with my fellow degree, one of the things that I do is have to do actually to get my doctoral degree is a little educational piece, and I've chosen diabetic foot care. So that's what we're going to talk about.
So first slide, as you can see, what we're going to talk about is some simple wound care basics. So we're going to talk about wound care today. So we're going to talk about the facts about wounds. Melissa's going to talk about diabetic foot wounds and foot care. We're going to talk a little bit about wound prevention and some items to have at home, some simple things to have at home that you can use. And then we're going to open up for some questions. So go ahead.
All right. So there's a lot of people with diabetes. About 7 million Americans are living with chronic wounds, usually due to diabetes. So how many of you guys are diabetic? None? Really? Well, that's a good thing. Okay. So one of the biggest problems when you have diabetes is maintaining your blood sugar to help keep your wounds and things under control. And sometimes if you don't know that you're a diabetic, you maybe haven't been diagnosed, and your blood sugars run high, then you end up with some things called like neuropathy, where you can't feel things in your feet. And then you might step on something and that creates a wound, but you might not know it's there. Okay. So then that leads to a whole big issue with infection and then potentially having to lose a toe, a part of your foot, or your whole foot. Okay. So if you're a diabetic, it's very important to take care of your feet. So you want to look at your feet daily. You want to wash them daily, put some moisturizer cream on them. Make sure you got good fitting shoes. Okay. Shoes are a good thing when you're a diabetic. You need to spend that little bit of extra money because they can be expensive, but sometimes your insurance will pay for it. But more than half of all foot ulcers that a diabetic will come across will become infected. And that leads to those problems like potential amputation and so on. So we want to prevent them. So how do you do that? You want to manage your weight. And how do you manage your weight? You want to eat the right things. You keep that blood sugar under control. Okay. Anywhere under 150 is a good blood sugar for you. Okay. And then the doctor monitors a 3-month running of your blood sugars called the A1C. And you want to keep that if you're diabetic at 7 or below. Okay. So that just means that you're keeping good control. Okay. So you want to wear the good shoes, manage your weight. So exercise, eat right. Good time for shoe fitting would be in the morning, because as we know, as we go on throughout the day, what's our feet do? They swell, right? Okay. So you don't want to go late in the afternoon when your feet are all swollen, because then you're not going to get fitted properly for shoes. Good socks. They always say like good cotton kind of socks, because that helps absorb the sweat from your feet. It will prevent the friction. which could cause wounds itself. Do foot stretches, so sometimes it's as easy as standing on your toes and going down, and that kind of stretches those foot muscles, okay? And then make sure you're taking care of your diabetes, if you are diabetic. Washing your feet, looking at your feet daily. And some people are like, how am I supposed to, I can't look underneath on the bottom of my foot, how am I supposed to do that? Well, we have long handled mirrors, okay? So if you are living alone and you don't have somebody who's looking at your feet for you, you have a long handled mirror. It's also important if you are diabetic, don't walk around barefoot. Okay, make sure you always wear socks with your shoes as well. And you want to make sure you're keeping your blood flowing, so getting up and moving. Okay, just simple walking will do. Okay. All right.
So Melissa just described one set or one kind of wounds that we deal with at the wound center. So I'm going to talk about another one that we see most often at the wound center, and that's called a pressure ulcer. A pressure ulcer is just like it sounds. It creates from pressure or either friction or shear of something. And generally what we see is it's caused from poor health, weakness, or limited mobility. It can come from soiled or wet skin or people who may be incontinent. Those are the individuals that may not be able to get up and go to the bathroom, or maybe wear Depends, and maybe they soil themselves, or they may not be able to change their Depends, so their skin get very wet. And also those people that may not get a good nutrition. So they may lack good healthy foods, or may not get a good, say, adequate protein in their diet, or just a good amount of water. So they get very dehydrated. So their skin, what happens is it becomes very weak. So what we start seeing is when they start sitting for long periods of time, that excess pressure, it creates a lot of weight. And soon we start seeing a lot of skin breakdown in those bony prominences. And we start seeing it anywhere you have right here on these bony edges. So your elbow, your knee, your hip, your butt, those are all bony prominences. So what can we do to kind of help relieve those pressures? So a lot of those things, we want to try to get those people to get off that pressure just enough to help it so we get away from that skin breakdown. Another thing, another set of wounds that we see are what's called arterial or venous ulcers. Now, these wounds are caused by reduced blood supply to lower extremities. And what this means is that either blood has the inability, once it gets down to your leg, that either it has the inability to get pumped back up, or the blood itself just doesn't get down to where it's supposed to in the first place. So that's what that means, is by that reduced blood supply. Common characteristics of poor circulation. So things that we see most often is discoloration of the legs. So you see people when they come in, then maybe their legs are like a color purple or reddish in nature. They may be legs that are very cold to the touch. So that's a very good example of blood not really circulating down to our lower extremities. And as we get older, blood generally stays in your core area. So it's this area right here. What's all in this area right here? This is your organ, your main organ, your heart, your lungs, your stomach, your intestines. So this is where all your main blood flow is anyway. So what happens is your blood takes a lot longer to go down to your arm, and especially down to your feet, and lastly down to your toes. So, and then unfortunately, gravity, as we get older, really plays a part in that blood, pushing it back up to our hearts. Another thing that we see is, does anybody in here get any swelling in their lower legs or their feet? Because what happens too is as we get older, you notice that as we sit or as we stand or as we walk for a longer period of time, we may get home and we look at our feet or ankles and they're a little bit larger than what we started the day out with. Well, that's because the water in our body, that's gravity. And what it does is called pulling. And it pulls that water down. It's a natural response. That's what gravity does. So we have to do things to help get that water and that blood back up into our body so it evens it out. But again, that swelling in our legs, if we can't get it up, all those characteristics, what they eventually do is they create little sores on our legs. And if we can't get all this blood to move and the water to move, we eventually start getting little sores on our legs that don't heal. So the other type of sores or wounds that we see are surgical or trauma wounds. So has anybody ever had a knee replacement? Or so you go in for a knee replacement, what happens? You come back out with a nice scar on your knee, right? So we have seen patients who've gone, they've had a knee replacement, and what it's been is right where that nice line where all the sutures are, where those staples are, it opens up. So now we have this nice big opening. So what we have to do is we have to go in and help them to get that hole back together again. Because now the surgeons can't just go back and staple it again because that skin has weakened. So we have to help them get that tissue to get stronger again. So we have to do some healing, some active healing. And we do that with what's called a wound vac. That kind of helps strengthen that tissue again so it heals the right way. So that's one of the surgical procedures. The other one is by trauma. Trauma, one of the things we see are by fall. A lot of times when we fall, we get scrapes, we get bruises, we get what's called skin tears, because as we get older, our skin gets paper thin. So it's not as strong as when we are younger and we fall and we bounce around and we get a little cut and within a day or two, it's all healed. It takes a little longer to heal as we get older. So with those skin tears, it just doesn't heal like it should. But then we've also treated burns. We get wounds because of car accidents, anything that's related to trauma. So those are all types of different kinds of wounds. So those are all the different types of wounds that we see. So we get diabetic foot ulcers, we have pressure ulcers, we have arterial venous ulcers, we have surgical trauma wounds. So we have a variety. So let's go ahead to the next one. So wound prevention. So one of the biggest things that we do at the Wound Care Center is not only do we dress the wounds, in other words, these are the treatments we provide to the patients. In other words, we do dressings. We may do what's called wound vac. We also do hyperbaric, but we educate the patients and we also educate the families. So what can you do to help yourself so the wounds will heal? First thing, stop or decrease smoking. That is the number one thing that you can do to help heal wounds. So if you're a smoker and you have a wound, first thing we'll tell you, you need to stop smoking right off the top. Why? Because a person who smokes, it takes a much longer time for them to heal. Number two, follow a nutritious diet, especially high in protein. Protein is a key component in healing. Now, I'm not telling you to go out and eat a steak dinner every night, But what you may want to do is, the insure shakes or any shakes that are high in protein, have one of those with your meals because those are really good to help with the healing process. So we encourage people to buy any protein shakes to have if you don't get a lot of protein in their diet. Wear compression stockings. So you can actually buy compression stockings at your nearest pharmacy. So if you notice that your legs are starting to swell, especially when you're off and moving during the day, you can go to your local pharmacy and buy some compression stockings. We suggest start at the lowest, which is about 15 to 20 milligrams of mercury. See how they do. If you notice that the swelling goes down once you put them on, great, keep to those. But if you notice that you're just not where maybe I should go, bump it up or just a little bit. But also talk to your physician because your primary care doctor can also recommend exactly what measurements to get, and they can also order you some as well. Elevate the legs to the level of the heart or above for 30 minutes daily when sitting. In other words, get home, if you have a recliner, put those legs up. That's one of the biggest things that you can do, because when we sit down, where's our legs? They're down below our heart, and what did I talk about? Where does all that water go? Straight down. And gravity loves us because it pushes everything downward. So if you can put your legs up, and the best thing is, if you can put your legs above your heart, even the best thing to do. Now, I know that's hard for a lot of people, but if you can do it, great. So, but if you can get your legs up, that's a good thing to do. Avoid standing for long periods of time. If you don't have to stand for long periods of time, don't. Give your legs a break. Because again, the longer you stand up, it takes a lot more force. It's a lot easier to push that blood down, but it takes a lot more force to push that blood back up again. And then if you're laying in bed, or if you know somebody that needs help when they're laying in bed, remember how I talked about the pressure ulcers? Turn every 2 hours. Remind people, don't forget to turn, especially if they're laying down during the day, don't forget to turn, because if you lay in one spot for too long and they're not getting it, say, an adequate diet, or they don't turn a lot, they can develop a pressure ulcer. So give them that reminder. So, simple items to have at home. Now, we get a lot of calls about people wanting to get into the wound center, but what can I do at home until I can get in to see you guys? So we tell people you want to keep your wounds clean and dry and covered. So those 3 things are the most important. So these are the main things to have at home. 1, simple gauze. So the gauze squares, you see them, you can get them at any of your local pharmacy. So if they're like 2x2s or 4x4s, if you get a little pack of those, and you cover that wound with that, that's your cover. You keep it covered. Paper tape. Does anybody remember the commercial about Band-Aids? About being stuck on Band-Aid brain because Band-Aid stuck on me? As we get older, we don't want Band-Aid stuck on you. Mere fact that the thicker it is, the more likely it's going to tear the skin around the wound even worse. So what we use is what's called paper tape. It's a lot gentler on your skin. So we get people with like the stickiest stuff on it, don't do it. Just stay away from it. If you can find paper tape, it's very thin and lightweight, and it's a lot simpler that if you're going to put paper on the gauze, it's a lot easier to take off. But yeah, don't use any of the sticky stuff. Stay away from it. if you can buy wound wash or normal saline. Now, there's nothing wrong with normal water. It's just if you can find normal saline or wound wash, what that is the only thing with tap water is sometimes you get the nasty stuff that's in normal tap water. Yeah, you know, normal saline just is a little cleaner. So you always want to keep it clean, dry, and covered. And can you use triple antibiotic one? Yes, you can. Make sure you use it around the edges, you know. And if you do cover it, make sure you put a very light film. Just a very light, you don't want to put a big gulp on it. How many people that if you get a cut, use Prox? Actually, you should not use peroxide. Yeah,
Only leave it on again.
yeah. You want to know why? Because actually peroxide will eat away at the good skin. So the best thing to do is use soap and water, or if you can use children water. So, yeah, it's funny because, you know, I grew up too with using peroxide, like I use peroxide on everything, but yeah. You may want to, if you do use peroxide, use it like the first time, and then after that, that's it. Like, but usually soap and water is the best.
They've even started to dilute it and do like tap peroxide, tap water, or saline or whatever. So,
Yeah. Right. And the last thing, and I forgot to put this up there, and I just thought of it, is when you shower or bath, one of the things that you do is that if you do have an open cut, or especially when you shower, when you take a shower, take a full body shower, and suppose your wound is down here on your leg. After you take a shower, get out and rewash that area down here. Want to know why? Because you just washed everything from your head and went down and washed right over there. So it's best that after you do that, get out. Because that way you keep it clean. And if you follow those couple of things and you use those couple, and it's simple things you can have right at home, you'll be fine until you can come in and see us and see one of our doctors. And that's exactly what we tell people. Keep it clean, covered, and dry until you can keep in the field.
Question.
I have a question. So I have a care manager. I have a client that actually just had some skin cancer removed. And they actually told her to wash the wound with soap and water and then put Vaseline on it before she damages that.
Right.
So what's the reason for the Vaseline?
Because it's like a burn.
So in that situation, because of the type of wound it is, that makes
Yeah. Because hers is like a burn, and so you want to keep it moist.
doesn't crack.
Yeah. And it's different kinds of wounds.
Yeah.
So, yeah.
any other questions? Yeah.
Could you repeat again? I know you talked about pressure wounds.
Yes.
My husband is very immobile. He has a walker, but can't use it too much. He spends a lot of time on the couch.
Okay.
We have a board underneath the cushions to make it so. He does get up, he does move around on the couch. But I'm concerned about the pressure. He could develop a pressure wound because spending so much time on the couch.
Yes.
Is that true?
Yes. The best thing to do is, one of the things you can do is, if you also try to get up, like if he can, since you said he uses a walker.
Yeah.
Is, even though he lays for long periods of time, try to get up every 30 minutes, even if it's the stand. We have patients that kind of like to lay in bed for like hours at a time, or sit in a chair for hours at a time. Well, we tell them is at the top and bottom of every hour, stand up. Even if it's for 1 to 2 minutes, Because what you do is you're relieving that pressure. And even if it's for 1 to 2 minutes, it'll help.
There's a lot of trouble getting up.
So even a little bit's better than none.
Yeah.
Yeah,
You already know where it is.
yeah, that also helps.
One side, big the other side.
Yeah,
Then he'll get up and he'll sit. Just for a while. But, yeah, so there we go. Conserving.
Right.
Like a robo person or something that might be to help relieve that pressure.
What kind of?
It was a robo.
Rojo. You can ask your primary care physician, they can order what's called a Rojo, ROHO. And what it is, it's an air-filled cushion. And what it does is once you pump it up, it has like little fingers on it.
Okay.
And it evens out the pressure. So if you're gonna sit for any long periods of time, it distributes the weight of an individual, and you don't have to use it in a wheelchair. You can actually use it in a recliner as well. Oh,
What about those gel seat cushions that I see? Are those helpful in any way or not really? They're more for comfort, but I don't know if they're really good for like running wounds.
yellow cushions, they are good for comfort. I don't know, really, there was not a lot, generally, there's not really much out there to really say yes or no either way. So, yeah, they're probably out there more like putting on a greater cushion. But you want to look at what pressure relief. Those are what's gonna really make a difference. Yes,
I just have a comment about the protein. Sometimes it's assimilation. It's like, well, like iron assimilation, I'm blood donor. I can remember years ago when my mother was about my age and she liked going, but sometimes denied for iron. And they said, have her drink orange, have her eat old, have her drink orange juice. That doesn't have vitamin C in it, but no, it works like catalyst. And so, I make sure that I have some vitamin C
right,
when I'm taking the iron. But my protein was going down kind of routinely. And this in Iowa, there was a hospital that had a walk-in. You could spend $20 and do a blood screening thing. The protein was going down. The doctor was a little concerned about it. So I got on the internet and checked on assimilation. I was thinking about the iron and donating blood, and came across something that said sometimes that it will help chew your food more. And not that the protein is digested in the mouth, that's the carbohydrates, but the smaller pieces make it work better in the stomach. And then they said, make sure you have acidic or fermented kinds of food, keep the stomach acidic.
okay,
Right, there's sometimes, and spread out the protein throughout the day. I knew I was consuming enough protein. During COVID, I was careful to make sure
right,
I was not exposed to them, and make sure I had what I needed. So I started doing this analysis, and the protein came up. And then I got to thinking, hey, so I had a year of chemistry. I still was a math major, physics minor, but science, that calcium is a base. It's right. And calcium, hey, my mother had osteoporosis and I broke my ankle in 1996. I was always paying attention, take the calcium. This is going to make the stomach less acidic. So make sure that you take like sauerkraut, pickles, and hey, something along with it, especially if you're taking calcium, which old women are doing. And my hair was getting thinner, but then hey, a lot of old people, I mean, not real thin, hey,
Right.
I can tell the difference, and I'm getting younger. No, but I think somebody else might want to know that.
Right, all that's good to know.
I have a question on the protein drink too. My mom's diabetic and she also has kidney disease. Is there protein drink that doesn't have as much protein in it? Because protein, too much protein is
Not good for your kidneys, yeah. You can also. One of the things you can do is if you talk to a dietitian, especially because of the diabetes and everything, they can also refer you, give you an idea of what you get. We have, like at our center, we actually have a protein shot that, we have a coupon for it in education that we sometimes give our patients that they can get through Amazon. And even if you're diabetic, you can do, and it's just a small shot and it doesn't affect the kidney. So,
How do you go to a dietitian? Do you have to get a referral from the doctor?
some there's some dietitians want a referral through it.
Hospital,
Um,
the wound care center, or somebody you work with?
we don't have anybody direct. No. It would be nice if we did.
These educators do provide some of that through the
You're right,
hospital.
yeah.
Yeah.
Any other questions? I was gonna bring some pictures, but I'm glad I didn't, now that you guys are eating one. Some of the pictures can get really ugly.
I hold on.